You know, it's easy to think of our body as a collection of separate parts. The heart does its thing, the lungs do theirs, and they just kind of stay in their own lanes. But what happens when the signals get crossed? Today, we're going to solve a fascinating medical mystery that plays out inside every single one of us: the incredibly deep and often very confusing connection between our heart and our lungs.
Right at the heart of this whole mystery is a question that doctors have to grapple with every single day. When a patient shows up in real distress, is the root of the problem in their heart or is it in their lungs? Because the clues, well, they can look almost identical, which makes it a huge diagnostic puzzle.
Okay, I want you to imagine this for a second. You're just going about your day, and suddenly you're hit with this terrifying feeling of being short of breath. Your mind immediately jumps to your lungs, right? Maybe it's asthma, maybe something else. But what if the real culprit is actually hiding right next door? This is the central puzzle we're going to unpack. So that feeling of breathlessness, the medical term for it is dyspnea. And it is the #1 most confusing clue in this entire investigation. Why? Because both your heart and your lungs have the same job: get oxygen into your body. When that system fails, the alarm that goes off is breathlessness. But it doesn't tell you if the fire is in the heart's building or the lungs building. Let's break this down. You can get that exact same scary feeling from two totally different causes. On one hand, you have cardiac dyspnea. That's when a struggling heart creates a sort of fluid traffic jam that backs up into the lungs. But then you have pulmonary dyspnea, where the problem is actually in the lungs themselves, blocked airways or something like that. To you, the feeling is identical. The root cause, completely different.
And oh, the confusion does not stop with just being breathless. What about a chronic cough? That's got to be the lungs, right? Well, nope. It can be caused by that same fluid congestion from a failing heart. Coughing up blood? Sounds like a lung issue for sure, but it can also happen when high pressure from heart disease bursts tiny vessels. Even a fever might not be an infection. It could be inflammation in the heart. The clues are all mixed up.
So you can see why this is a real maze for doctors, right? The symptoms are pointing in all different directions at once. So how do they even begin to figure it out? Well, let's see what happens when we start bringing in physical exams and medical tests. All right, let's take a classic sign, a wheeze. That high-pitched whistling sound when you breathe. For just about everyone, that immediately screams asthma or some other lung problem. It feels like a slam-dunk clue, a case closed kind of thing. But is it really? Well, get this. There's a condition doctors call cardiac asthma. That fluid backup from heart failure can actually swell the tissues around your small airways, literally squeezing them and making a wheezing sound that is identical to regular asthma. It is the exact same clue, pointing to two totally different culprits. Okay, so the physical exam is tricky. Let's bring in the tech. A chest X-ray should clear things up, shouldn't it? Well, not always. An X-ray might show some shadowy spots called infiltrates. But is that fluid from heart failure, or is it an infection like pneumonia? It could show fluid around the lungs, a pleural effusion, but is that from high pressure from the heart or from a problem in the lungs? The picture itself is still a mystery. All right, we need a more definitive answer. Let's go to the blood work. There's a protein called troponin, and it is the absolute gold standard for telling us if someone's having a heart attack. When heart muscle gets damaged, it leaks troponin. So this has to be the specific clue for the heart, right? But here's the million-dollar question. Is that test, the one we totally rely on to diagnose a heart attack, is it possible that it's not just a sign of a heart problem? And the answer, incredibly, is no. A huge event in your lungs, like a blood clot called a pulmonary embolism, can put so much strain on the right side of your heart that it gets damaged and releases troponin. Even chronic lung diseases, like severe COPD, can strain the heart over a long time, causing troponin to leak out. So our gold standard heart test can actually be screaming that there's a major crisis happening in the lungs. Okay, we've been chasing clues down all these different paths, and we keep hitting dead ends. The symptoms are confusing, the signs overlap, the tests are ambiguous. It feels like we're just going in circles. And that's because maybe we've been asking the wrong question this whole time. This is where it all starts to make sense. What if the answer isn't a choice? What if it's not heart or lungs? What if all the clues overlap for a very simple reason, that the two systems aren't really separate at all? This is the solution to our mystery. The heart-lung axis. It's this idea that your heart and lungs aren't just neighbors living in your chest. They operate as a single, perfectly integrated machine. A problem in one will inevitably cause a problem in the other. They are inseparable partners in the business of keeping you alive. Let me show you exactly how this works in a condition called cor pulmonale. It all starts with a lung disease like COPD. This lowers the oxygen in your body. In response, the arteries in the lungs actually constrict, which raises the blood pressure inside them. Now, the right side of your heart has to pump against all this crazy resistance. Over time, it just gets overworked, it gets bigger, and eventually it fails. And just like that, a lung disease has now become a heart disease. So we've seen how one side of this axis can bring the other one down, but what happens when something comes along that attacks the entire system at the same time? Let's talk about a shared enemy that exploits this connection with absolutely devastating results. I'm talking, of course, about smoking. If the heart-lung axis is the hero of our story, then smoking is the absolute supervillain. It doesn't pick a side. It's a mastermind that wages war on the entire system all at once. Just look at this. On one front, it's hammering the lungs, causing all the things we know about, COPD, cancer, you name it. But at the exact same time, it's launching this full-scale assault on the heart, causing coronary artery disease, heart failure, and dangerous arrhythmias. It's fighting a two-front war against a single connected system. And here's the truly terrifying part. The damage isn't just added together, it multiplies. The COPD it causes leads to heart failure, just like we saw before. And the heart disease it causes leads to fluid backing up into lungs that are already damaged. It creates this awful, vicious downward spiral, where each broken part makes the other part even worse. So this isn't just some interesting medical trivia. Understanding this connection, this axis, has incredibly profound real-world consequences for our health, for our survival, really. Let me be perfectly clear about what's at stake here. The data is just unequivocal. When someone has damage to both their heart and their lungs, their risk of death just skyrockets. So understanding this heart-lung axis isn't an academic exercise. It is literally a matter of life and death. So what's the big takeaway from all of this? First, stop thinking of your heart and lungs as separate things. They are a single team, a single unit. Second, when you feel a symptom like a cough, it's not just a message from one organ, it's a status report on the whole system. And that means true health is about taking care of the entire axis. Because you can't have a healthy heart if you don't have healthy lungs, and you can't have healthy lungs without a healthy heart. And that leaves us with one final thought to chew on. If we really accept that our heart and lungs are one integrated system, how should that change the way we think about, well, everything? From our diet and our exercise to how we practice medicine. It completely reframes the whole picture of what it means to be healthy, forcing us to see our body not as a bag of parts, but as the incredible interconnected system it truly is.